Mental health is sometimes difficult to talk about, but is the stigma surrounding the subject getting better or worse?
There's still a job to be done around battling stigma and prejudice, and it is still, we are much more open now about talking about mental health issues, but it is still quite difficult for many people to talk about their mental health issues. And in a work situation, for example, there aren't many people who would be willing to talk about the stress that their work causes for them. Because that, for many people is an admission of weakness. So I think there's some quite profound cultural changes that we need in the workplace and elsewhere, which would encourage people. But yeah, we think progress has been pretty good over the last period of time, but it does need to be maintained. Well, stats are fairly simple. It's 1 in 4 of us who will need help with mental health issues at some point in our lives. So the population of Southampton is, 220,000. Then, you've got 50,000 plus people who will need, clinical help with mental health.
Whether you know it or not, 1 in 4 people suffer from mental health issues. So the likelihood is you know somebody who has or is still suffering from it. But it's not all black and white. Whether it's psychosis, depression, anxiety, or even OCD, it's all to do with your mental well-being.
As humans, if we're uncertain about something, we tend to default to catastrophic thoughts. And so if we don't know what mental health is, and we don't know what mental health looks like, and we don't know what people who suffer mental health problems do, then that generates a degree of uncertainty and anxiety, which might then result in more difficult, stigmatised and avoidance behaviours. We're trying to reduce the stigma by increasing understanding and therefore reducing the uncertainty that people may have. Has been a fairly effective way of reducing stigma about people with mental health problems as a whole. Media attention tends on the whole to be fairly negative. It tends not to focus on the distress that people experience, but tends to be centred around maybe some of the difficult things that people have done whilst suffering a mental health problem.
We did some work recently in the SO18 area of Southampton. We were talking with people in the community about the kind of help that they would need with, and that they saw, the problems they saw around them in relation to mental health and what they would like to see. And one of the things that a number of people said was, we don't know how to talk to someone with a mental health issue. I know that my neighbour, a few doors down the road, has got a mental health issue, but I don't know what to say to them. And so I think there's a kind of educational role that all of us got in mental health services around trying to find a language for people to be able to talk safely and raise mental health issues with other people. So we're not there yet, but we're making some progress.
The government, schools and workplaces are trying to encourage people to be more open about their worries and stresses. But is it enough? We have made a vast improvement over the years, but with cuts to the health service, it's difficult to say where we'll be in 10 years' time. April Brown, Solent News Now.